Most pre-workouts these days come loaded with caffeine to help you work out harder, as it's known. Though sometimes they are dosed incorrectly or people consume too many scoops of pre-workout considering the effects would be better. You must limit your caffeine as it can cause serious health consequences. CL, a 32-year-old female, took pre-workout before going to the gym. She thought the more caffeine she took, the better the results. And instead of taking the prescribed amount in a small dispenser, she used a bigger scoop and took about 5 grams of caffeine instead of its regular dose of 300 milligrams. The woman then was rushed to the ER because she was complaining of weakness, anxiety, dizziness, and malaise. However, she denied any chest pain or fever. At the ER, she was checked for her level of consciousness. The doctors used a scale, the GCS Glasgow Coma Scale. This patient, at the time of presentation, had a score of 15, the highest. That means the patient is completely conscious. While the lowest, which is 3, generally occurs in case of severe head trauma and generally leads to brain death. However, in this patient, our vitals were normal. The blood glucose was noted at 147 milligrams per deciliter. Hyperglycemia, hyper means high, glycemia means glucose, emia means presence in blood. Soon after this observation, the patient felt dizzy again and she threw up. The patient was agitated too. At this point, her mental status declined rapidly. Her GCS score, which was once 15, was down to 11. Her BP, though normal, she had an increased heart rate, tachycardia, or tachy meaning fast, cardia, heart, at around 160 beats per minute. The doctors then immediately checked her ECG and found polymorphic wide complex tachycardia. ECG can tell us a lot about what's happening in our body. This type of severe tachycardia and arrhythmia, because of polymorphic as in the heart is not beating regularly, means that the patient can be under adrenaline stimulation and other metabolic disorders like too much or too little of electrolytes. Upon checking the arterial bed gas, basically checking the pH of her blood to know if she is acidotic, basic or alkalotic, and the oxygenation status of the blood, it was found that she had a pH of 7.29, while the normal should be between 7.35 and 7.45. As we can see, even a tiny change under or over the normal value can cause serious health issues. Shows how carefully our bodies are maintained at an equilibrium. Her other parameters revealed bicarbonate levels of 16.1 millimoles, while the normal should be between 22 and 26. If you know your chemistry, you know that low levels of bicarbonate, a base, and alkali means there are high levels of hydrogen ions, H+, which can make the blood more acidotic. She also had high lactate levels, suggestive of tissue damage due to lack of oxygen. Her other labs showed mild leukocytosis or elevated white blood cell count, white blood cells which generally fight off infections. However, in this patient, it can also be elevated due to inflammation, mildly however. The patient also was noted to have hyperglycemia. Her sugar was around 247 milligrams per deciliter. The patient also had hypocalcemia or low levels of calcium in blood and hypophosphatemia, low phosphor meaning phosphorus, emia means presence in blood. All of these are known effects of caffeine or any other sympathomimetic toxicity, or the agents that can make your heart go faster and cause heart attack and excessive urination. The lower levels of electrolytes like calcium and phosphorus all shows that the patient was losing volume. This can be due to urination and sweating. The more stimulated you are, the more that patient can urinate and sweat. Urination is also a known side effect, diuresis of caffeine. All of these can cause the heart to go haywire, and it is a leading cause of death due to caffeine ingestion. Although there is no specific antidote to caffeine toxicity, the patient should be managed supportively. The patient was given propranolol, a beta blocker. This can actually help in reducing the effects of sympathomimetic drugs or sympathetic effects, or help reduce in heart rate, the sweating, the anxiety feeling as well. The patient was then replenished with potassium and phosphorus, which were low in the patient, and with the correction of phosphorus and potassium, the calcium levels also get corrected in our body to restore normal electrolyte balances. So was also given regular IV saline to correct her dehydration. The patient were then revealed that she was consuming too much caffeine before coming to the ER. After stabilization, the patients were then observed for 48 hours and was discharged with a follow-up cardiac stress test to rule out any other heart problems. This case is an excellent demonstration of why caffeine intake can be dangerous. It doesn't take a lot of it to cause severe toxicity and poisoning. It is common among students and avid gym goers to drink copious amount of caffeine before exams or before working out. It is highly inappropriate and dangerous to do so. Always be careful with caffeinated products, take care, and always remember to not take more than what is prescribed.